America is losing their doctors, and we need to talk. Recent reports show that a third of physicians are already thinking about leaving their practice or have already left completely. Hi, my name is Christina and was one of those people that actually pivoted to non-clinical medicine. So this isn't just a handful of people having a bad week. It's a system level red flag. So in med school, we were sold this noble calling, hours of charting every single day, and a schedule you don't necessarily have full control of. Burnout numbers bounce from survey to survey, but they consistently show that around half of the physicians have at least one symptom of burnout, and this is already after things have improved after the pandemic. In primary care specifically, more than half of the doctors report being burned out, and about a third of those plan to stop seeing patients in the next 1 to 3 years. So if you're in med school, residency, or are already an established clinician and are thinking to yourself, is it just me? No, the building's actually on fire. At the end of the day, work-life balance ranks as a top priority for both younger and older and more established clinicians. Here's the part that nobody really tells you when you sign your life away to a pre-med track. Your medical training is a skill set, and it's not a prison sentence. The job market is full of non-clinical roles that run quietly on physician brains. You find these roles in health systems, life sciences, insurers, and tech. Where exactly are doctors going when they step back from the clinic? One option is clinical research and trials, where you design and run studies that affect thousands of patients at once. There's also roles in pharma, medical affairs, medical science liaison roles, where you shape how drugs get tested, approved, and used, often with pay that can match or beat clinical income. There are also health tech roles, informatics, and payer or admin roles where you help fix the system instead of being crushed by it. And then of course, there's entrepreneurship and creator lane where you are building businesses, consulting, making content, and you're using your MD as credibility while operating outside of the traditional clinical setup. Staying in clinic is valid, leaving is also valid. So if you're watching this and you're still all in on clinic, or you're secretly questioning it, or maybe even you're actively planning your exit, your story might be exactly what another doctor needs to hear or read to realize that they're not alone and that there's life, meaning, and impact beyond the exam room.